Hello guys, this is Dr. Evans and today I'm going to talk about snake bites. Having an ophidiophobia myself, that is overwhelming fear for snakes, I've only managed to come across around 3 to 4 snakes, that is the cobras, the normal puff adders, the green and the black mambas. And knowing how dangerous these snakes are, I've developed this interest to talk about snake bites. We know there are some rumors about how to manage snake bites. There are these people who are saying that there's a stone that can suck out the poison of a snake bite wound. Some saying you can just squeeze in some lemon juice on a snake bite wound and it will heal itself. There are some people who are actually saying that if you drink a virgin's urine, immediately after a snake bite, you'll be healed. But today, we're going to debunk this notion so that we can come up with the elaborate measures to do when you have a snake bite. It's a rainy season, as we all know, and we know these small holes that these snakes live in are usually filled with water. So the snakes will come out, and when they come out, they'll be looking for alternative habitats. So it's recommended that you stay at high areas and be on the lookout for these snake bites. So what exactly do you do when a snake bites you? This is the question that actually I want to focus on today. The first thing I'll advise you is to move to a safer place so that to avoid a second bite by the snake. From this position, take a photo of the snake or take your time to look at the snake. This photo will help the doctors to be sure of the exact antivenom they will give you. However, if the snake has gone away, don't go back there trying to look for the snake so that you can take a photo. Ensure that when you're taking this photo, your safety is ensured. Number 2, some people resort to killing the snake first so that they can carry it and take it to the doctors so that the doctors can see it. It might seem like a good idea, but be sure by doing so, you're putting yourself at risk. Over 10,000 cases worldwide has been reported about people being bit by decapitated snakes. So I will not recommend for you to kill the snake. The second part is about positioning of your limbs. Let's say your leg has been bit or your hand has been bit. Do you put it high up or do you put it below? Some experts say that you can put your limb below the heart level to reduce the speed at which the venom spreads to your system. However, some experts still say that it's recommendable to raise the bit arm above the heart level to reduce the swelling. So it's neither here or there. You can still position it below the heart or above the heart or even at the level of the heart. But I think I'll go for the below the heart level. This will reduce the rate of spread of the venom to your system. How about tourniquet? Kuifunga. How about tourniqueting that part or pressure immobilization of that part? Still under discussion. This tourniquet application or pressure immobilization has its own disadvantages because with pressure, it compresses the arteries, which might lead to ischemia. At the same time, these tourniquet and pressure applications might expose the tissues around the venom for a longer period, and this will increase the hydrostatic pressure that will lead to tissue injuries. So sometimes you can apply them, but not for longer hours. I won't recommend it for longer hours. Some people resort to applying ice packs on the bit area. This you can do it for around 10 minutes to 15 minutes, but not for very long periods because it may lead to necrosis of the area applied. There's some geniuses here who actually attempt to bite or to excise the area that has been bit. Like in these movies I've been watching, the Jet Li's and the Jackie Chan movies I've been watching, these guys, they usually bite the area. They bite the area that has been bit by the snake, and then they try to suck out with their mouth, and then wanatema huko nje. This is not recommended. Actually, it doesn't work in any way. When you bite the area, or when you try to salvage the area and then suck out with your mouth, you'll be introducing your flora, the mouth flora, to the site. At the same time, you'll be increasing the wound area. So I won't recommend doing that. Tumefika hospitali. You're now at the hospital. As a doctor, what do you do? The first thing you do, the ABCDE of resuscitation. Check the airway, the breathing, the circulation of the patient, disability, and then expose the patient. Check the blood pressures. If they are low, you hydrate the patient. Check the saturation for oxygen. If they need assisted ventilation, you do it. You can intubate the patient. You can put them on oxygen. On exposure, you assess the site of the bite. Probably it will be swollen. There could be multiple bite sites or single bite sites. It could be swollen, it could be red, and perhaps tender. There are some principles that you're supposed to follow when managing this kind of patient. Number 1, you have to administer analgesia You can use the common PCMs, the common NSAIDs. That will work for the pain. If the pain persists, you can do diclofenac. The second thing you do is to administer antivenom. There are two types of antivenom. We have the monovalent and the polyvalent antivenoms. But how do we make antivenoms? The snake antivenoms. They're usually made by introducing the snake venoms to the horse, an unlethal dose of the snake venom into their bloodstream. These horses will be hyper-immunized, and when they are hyper-immunized, they develop neutralizing antibodies against those snake venom. Then eventually the blood will be collected from them, purified, and then processed to form the antivenoms. So there are two types. We have the monovalent and the polyvalent. The polyvalent will act against two or more species of the snake venoms. The monovalent, on the other hand, will act on one species. But if the patient has the exact photo for that snake, you can check the snake and then check their exact monovalent antivenom vaccine. The second part is to want to debride, to cut and debride the snake bite. If it's necrotic, that is, you have to check if it's full thickness necrosis, you'll have to do fasciotomy or amputation of the affected part. However, if it's superficial necrosis, you can simply debride the area and the patient will be assured of full recovery. After debriding the bite wound, dress the area with a tight-fitting Actisob absorbent. You can hydrate the patient, make sure that the patient is well hydrated. You can administer antibiotics. Floxapen can work on this case. Then you can give tetanus vaccine. In the same regard, there are some basic tests that you have to do. You have the full hemogram, the UECs, and the coagulation profile, as some snake venom can cause DIC. So you have to do all these tests so that you can determine the exact mechanism of management for the patient. Thank you so much. I'm hoping you have a snake bite-free day and year. Take care. This is Dr. Evans. See you in the next one.